First of all, good morning, everyone. My name is Raquel Ares, and thank you for joining this workshop organized by Silo in the framework of the Health Innofacilitator European project. Silo is a consultancy firm based in Madrid, which is a knowledge-intensive policy-oriented SME specialized in science and innovation governance, procurement, and knowledge and technology circulation in the international context. In addition, we are partners of the Health Innofacilitator project. Let me share my screen to show you just some minor. Sorry, that not works. Let's try again. Okay, here it is. I will do it bigger. Okay. So, thank you for joining this workshop into the process of public procurement of innovation. The goal of this workshop is to help you understand the factors that impact the design of a PPI system. This is the first workshop of a series of 3 oriented towards providing public budget management teams, as well as suppliers, with the necessary basic skills to prepare and launch a public procurement procedure and to successfully participate in it. Before starting, I would like to share with you some housekeeping rules. The first is that this workshop is being recorded. You have been informed when joining this meeting, and the recording will be available on the Health Innofacilitator community platform and our website 1 or 3 days after this session. Second, if you have any questions, please type them in the chat box and we will try to solve those during the workshop. If there is no time for that, do not worry, because we will reply to you with the answer, okay? Also, you can see your micros and cameras may be open because this is a workshop, this is not a webinar, so please be proactive, be participative, and don't be shy, okay? Yeah. Also, you will be asked about the quality of this workshop at the end of them. So please answer this survey because your feedback is very valuable for us. On the right side of my slide, you can see the agenda for today. First, we will count with Silvia Paolella, International Affairs Coordinator and Medicine, and Project Coordinator of the Health Innofacilitator, that will introduce the project and the benefits of being part of the Health Innofacilitator community. Then, Diego Muñoz, co-founder of Silo and Health Innofacilitator Advisory Board member, will guide you on a practical session about how to design a PPI system and how to select the best work procedure for each type of PPI. After a brief coffee break, my colleagues Antonio Guimarães and Diana Cortez will show you a PPI process step by step. We'll provide you with some training resources, and finally, we share some success stories. And now it's time to start. So, Silvia, the floor is yours.
Thank you very much, Raquel. I will share my screen. I don't see you anymore, so I hope it's working well. Welcome to the first workshop of the Health Innofacilitator project. As Raquel said, I have the pleasure to coordinate this project for Médecins Paris Région, which is the health cluster of the Paris region. So Health Innofacilitator is the European facilitator community promoting public procurement of innovation in healthcare. We have begun this project in last October. We kicked it off in November. So we are right now at our first workshop that participate to reach our objective, at our 6 very ambitious objectives that the project has. So to foster and nurture a sustainable community of innovation procurement, I will get back to it. Increase the awareness, skill, and knowledge of innovation procurement. That's why we're here today. Improve SMEs and startup capability to access innovation procurement. Leverage capacity amongst the buyers. Enhance cooperation between public and private organizations. And promote best practices, value-based procurement, EU dimension of solution, and new cooperation model. Okay, So I just want to quickly talk about our consortium. We are 7 partners with HEPA that is linked to Reza's affiliate partners. We represent all of the stakeholders of our initiative, that is this project. And I will just go over this next slide. What I wanted to share is that we are building a community, and a consortium is the first layer of this community. We have then an advisory board, as Raquel mentioned, with the participation today with Diego Munoz, that is one of our panelists, and we have CBER, Medtronic, HEPA again, SILO, and EITS as part of this advisory board that gather every 6 months to just talk about the progress and share their view on how we're progressing. So this can be the second layers of our community building. Then we have the advocates. We began to contact the advocates of Innofacilitator last month. We can see right there on the screen 5 advocates that we have. It can be like Hôpital Foch hospitals. We have an accelerator that is Paris Santé Campus in Paris, and we also have European projects like Procurement, Innobuyers, and we have through the participation of Maria Sanchez in our advisory board, EATS. So these are the first 3 layers of the community building. As Raquel said, I just wanted to really emphasize on the perks of joining the Innofacilitator community. And one question you may have, so how do we join this community? You see a QR code on the left of your screen. This QR code normally goes directly to the website you see on the right. That is a platform that is a Health Proc Summit platform, and you have a sub-community that's the Health Innofacilitator community. In a few words, if I can say so, it's like, I would say, like a LinkedIn for public procurement innovation, where service provider can present their solution, and hospitals public buyers can also express their needs. And we are organizing June 21 a launch event where we will explain how it works, what are the perks, how you can participate directly to the community. And excuse me, just one mistake. The QR code goes to I just changed that, goes to the link to register to the community, to the launch event of the community. And at the end of the presentation, you have the QR code to go directly to the website. But yes, if you scan this QR code, you go to the registration of the launch event on June 21st. So don't miss that. And we really at this time, we just launched this platform for cooperation with the as Procurement Summit. So don't hesitate to give us your point of view on how we are advancing on this platform and how it's working for you during this launch event. So one other thing I really wanted to talk about is that one of the first things we did with this project is to ask ourselves what already exists. And we created a capacity building catalog on the website that I will also link at the end of this presentation, with, if I'm not wrong, 33 materials, available training resources in the area of procedure and good practices related to health topic, sustainability procurement, evaluation frameworks, intellectual right management, because we really ask ourselves what has already been done in order for us to build these trainings, like today's workshop, on what has already been done, how we can improve it, and go beyond what already exists with the creation of new content through this project. So it is right now live on our website. It's in different languages that are indeed present in our consortium. So don't hesitate to check this out. And now we go to today's why we're here today for the workshop. So as Innofacilitator has 3 training package. First, we have the leveraging on best practices, success stories based webinar. We just began this last week, so I will go through this again because it's our next event. Secondly, that's where we're here today, is the second training package on support for innovation and technology management. And the third, that is training support and coaching package towards the public buyers, with 5 public buyers receiving direct coaching session. This we will select the public buyers with the help of our advisory board. So it's not right now, but it's don't hesitate to follow us on our social media, so you can see when we will open the visitor training package. So we're here today for the first workshop that you see on the left of the screen, and I just wanted to also draw your attention to our second webinar on success stories that will be June 8th. You have the QR code that goes again directly to the registration page. It's on the EURIFI project, an example of cross-border value-based innovation procurement action. It will be June 8th from 10:30 to 11:45. So don't hesitate to register to our next event as well. And this is for me. Don't hesitate to follow us on LinkedIn. You have the website where we have our catalog building capacity on there. And if you go to this QR code, you can directly join the community and see the platform and how we are advancing. Thank you very much for your attention.
Okay. Thank you very much, Sylvia, for this useful information, for summarizing this interesting project. Well, now it's time for Diego to start with the practical session. Please, I remind you that in case you have any doubt, any thoughts, please do not hesitate to share it within the chat box, or just raising your hand, and I will give you the floor to ask to our colleague Diego. Okay, so Diego, the floor is yours.
Thank you very much, Raquel and Sylvia. Good morning, everybody. Thank you for joining the program today, this workshop. As Raquel said, I'm a co-founder and executive partner here in Silo, and I'm also part of the member of the advisory board of this Innofacilitator project. So to make the presentation very short, I've been involved in innovation procurement for a long time now. I was lucky to be part of the team in the Ministry of Science and Innovation more than 1 decade ago, designing the current innovation procurement policy in Spain, and then in Silo, I've been involved in many, consulting regional governments here in Spain, national governments in Latin America, and also, playing a significant role in dozens of PPI implementation projects. So, taking stock of this experience, I have tried to design a very, as Raquel said, practical agenda workshop. So we're gonna ask you to answer some questions, and then please to engage in a hopefully fruitful conversation among those of you which falls in the, let's say, supply side, those of you who are working for an RTO, an SME, an innovative SME, a company, a supplier of innovation or potential supplier of innovation, and with those of you who falls on the demand side, public entities, contracting authorities, public sector in general. So the whole session will be established as a dialogue between these two let's say, communities. And well, the agenda is split into two parts. The first one will, in the end, try to offer you some tips or lessons learned on how to design a PPI system. And the second one will do the same with the award procedures of innovation procurement, right? So let's get into the first part. And prior to, I will get very soon into the first, questions and dialogue on between these two communities. But I would like to start first with just one slide, sharing with you a table, a piece of information that I like very much, and I use very often in presentations. It was produced by Wouter Stolvik, and he was the founder and for many years the director of Piano. And if you are not familiar with Piano, that's the let's say the Dutch government public procurement expertise center. So it is a kind of a public agency answering to the Ministry of Economy and whose aim is to professionalize the public procurement within the Dutch government, especially in those, complex procurement, strategic procurement, sustainable procurement, innovation procurement. So Mr. Stormvik, more than one decade ago, he produced this table that, as I said, I like very much because it's like a way to compare what for me is like two cultures, pointing a cultural divide between public procurement and private sector market procurement. So for sure, that's going to be very familiar for you, but I find it very, very useful to provoke a conversation. So as you see, there is this kind of dialogue, right? The public procurement is static. It is a take it or leave it kind of game. When you have, public tender, you have to stick to that. And if you are a supplier, you cannot renegotiate the terms of the tender. Of course, when you have get engaged in the contract, there is possibility to modify that contract, but it's not an easy and a quick process. On the contrary, it is a painstaking process. So it is, in the end, a take it or leave it kind of game. You cannot renegotiate the conditions. You have to follow very static procedure. While in the market, on the market side, on the private sector procurement, you have a very dynamic game. The needs of the procurer are even daily updated. Once on the public side, you have to stick to the needs one defined. So for the procurer, it is also a very static and a very rigid game. You cannot redefine your needs. You have to stick to those needs that you defined maybe months ago when you started to write the tender and to start the whole process, which is a long process, prior to publish the tender. While on the market side, you can update daily the needs. You have this freedom of contract. While on the public procurement, you don't have that possibility. And in the end, it's kind of funny, but on the public procurement, being a very static game, the supplier is the king. I mean, you have to stick to those rules that you have, let's say, engaged with when you sign the contract, and you have your rights that the law, of course, supporting the supplier to regarding these rights. While in the market, of course, the customer is the king, and the buyer is the one who really have the power to renegotiate. So in the end, and that's why I have highlighted that file, right? On the public procurement, let's say, game, you have to buy what is offered. And this is the key regarding innovation. You have to buy what the market is offering you, while on the private sector procurement, you buy what you need. And in case procurers are not ready to supply what you need, you can engage into a dynamic process in which, in the end, you get what you need, right? And you can establish phases or whatever you need to get to that point. So this is the main, regarding innovation procurement, this is the main difference, and that's why, let's say, we have to come up with innovation procurement to try to break the rule in which public procurements have to buy what the market is offering instead of buying what they need. And the thing is that, as I said before, we find here like a cultural divide, and what we find, and in our experience, in the experience of Silo, many companies that we work with, especially SMEs, even being the most innovative, if they are not familiar with public procurement, if they are not incumbent to the process, they find it very hard to play with the rules. While on the other side, what we find is that many public procurements, of course, they find it very hard to play by the innovation rules. Even if they engage in innovation procurement process, if they have this room for freedom to let's say, try to make use of some of the market rules, it's very hard to them to play with the innovation rules. So I mean, taking this starting point, what I would like now is to get into the dynamic, into the workshop, and we will start with the first quiz, right? As Raquel said, and I said in the beginning, we want to make it very participative and try to establish a dialogue. So we are going to get into a kind of game in which we would like each one of you to walk into someone else's shoes, right? So if you feel that you fall on the demand side, maybe you're not a contracting authority, but maybe you are whatever, a public consultancy which is supporting, a public consultancy which is supporting contracting authorities, or even a public research body which is used to provide advice, innovation, procurement, whatever. If you fall on the demand side, we are going to ask you to answer just those questions which are directed to companies, to providers, right? And the other way around. If you feel you fall on the supply side, either because you are an RTO involved in tech transfer, you are an innovative SME, a large company, whatever, which is providing services or products to the public sector or willing to do so, please answer those questions which fall on the demand side. So we try to check to what extent this cultural divide is really so big or not, and we can get into a funny conversation even. So questions are always in this first part of the session. It is you have to rate your answers, right? You have to answer 1, 2, 3, 4, or 5, where 1 stands for strongly disagree with the statement, and 5 stands for strongly agree with the statement. So there will be 6 questions, so 6 answers in this first slide. In 3 of them, we ask those of you again which falls on the demand side to consider for a moment that you are an innovative SME with little or no experience with the public sector. Try to consider that you do have experience with public R&D calls. You may have a project funded by a regional or national agency, even by the Commission through the framework program, whatever. You are familiar with the stated rules and with calls, but not so much with tenders and with public procurement, right? And then please consider you are an experienced large company which is working regularly with the public sector and also involved with contract research with universities or R&D centers, right? So if it is clear, if not, please, just raise your hand or whatever, or write questions. I'm looking to Diana, which is here with me in the room in Silo, and she is in charge of the Slido app. So these are the 6 questions. You should, I guess, every one of you. I'm not seeing your faces. Every one of you have logged into or get into Slido.
Maybe we can come back to the slide.
Come back to the code, to the QR code, right? Thank you. Yeah, so please get into the Slido program, into our session, or you can do it also up right. You see, you can get into the website and with a /161 and so on. So I'm assuming that everybody has already get into Slido, and we can come back to the questions. So the point is that the whole point of the slide is that once you have answered the questions and Diana is sharing the results, I would like those of you who are indeed SMEs or companies or whatever falling on the supply side to see if you feel that whatever the results or the answers we get somehow are familiar for you. To what extent the results correspond to as providers, right? So I don't know how.
Yeah, I only see two people in the quiz, so maybe I'm going to put information in the chat so you can enter through the web.
So the three questions regarding the SMEs, I will read them very quickly. The first one is, try to imagine that you have attended your first open market consultation session. You want to engage into an innovation procurement project. And I mean, once you, let's say, to what extent do you agree with this idea that once you have attended your first open market consultation session, you feel you're ready to participate in the innovation procurement tender? The second one is that to what extent do you think that whatever your country within the EU is, that your regional or national innovation agencies have a proper innovation procurement support service, which helps you identify opportunities and guide you through the different processes in innovation procurement. To what extent do you think that you are clear about who is your internal customer inside your target public procurement? I mean, if you want to engage in public procurement, for sure you have meetings and conversations with different people within your target public procurer, maybe let's say more a policy maker who is setting the agenda for the organization, or a lead owner who is in charge of the service, or maybe even you are somehow getting in contact or in touch with procurement officials, and you are somehow, learning how public procurement works. So, are you clear about who is your internal customers? It would be the three questions regarding let's say, this game, like if you were an innovative SME. And then the three questions for large and experienced companies will be, well, let's imagine that the PPI tender has been identified at the same time by your commercial director and the R&D or the innovation director. And let's say that you are the CEO or the director for strategy, and you believe that it's going to be easy to align their interests, the interests of the innovation or R&D department and the commercial or marketing department. Then the second one will be that, you get to know the innovation procurement, the tender, and you believe it's going to be easy for you to identify good R&D providers, universities, technology centers, whatever, with which you are going to establish the contract research activities to fulfill the requirements of the tender, right? And the last one will be to what extent do you think you know how to approach and negotiate IPR with these partners to maximize your chances, considering that it may happen that in that tender you do have to undertake R&D activities, so intellectual property is going to be developed within the project, and you have to negotiate prior, advance to the project is with your providers. So these are the six questions. I don't know if.
Yeah, I think we can wait a couple of minutes so everyone. We have 8 people now.
Okay, I think we are like 25 or 30 people. So let's say half of them probably will fall on the demand side. So I think if we have 8 or 9 answers, I can stop sharing the presentation.
We have 9 already, so maybe.
Yeah. Yes.
Okay, so I will share my screen now.
So let's see what we come up with. And now it will be time for procurers to see what they feel about these answers.
Okay. So now, I think I'm not sure if we should see the results already. I don't know why. Oh.
Sorry, it was muted. Remember that one was strongly disagree with the first question, which was
You have it now.
yeah, I have get to know this. I have participated in the open market consultation, and I feel I'm ready to go for the tender. So maybe we can at least go through the three first.
Yes.
And then okay. Second one, my innovation agency, regional, national, whatever, are supporting me, very much with innovation procurement. And let's say that most of you disagree in this case. Although there are a number of them which strongly agrees. That would be also nice to hear from them where are located. Then I'm clear about who is my internal customer, and wow, this is very interesting. Most of you, let's say, agree with this statement. So now it's time for those of you who are companies or, as I said, RTOs. Which are your feelings? Do you feel that these results correspond to your experience? I mean, let's open a conversation. We can either go to whatever the questions or the three of them in general. I mean, open for both approaches. So who wants to break the ice?
Yeah, someone wants to activate the micro and talk. There's no problem to do it.
Good morning, Diego. Thank you for the questions that I find them very useful, seeing them from the practical perspective. There is one question that for me, from the practical perspective, it's really important, and it's if I do not remind about the fourth or the fifth. If you can put down a little, please.
Yeah.
The fifth, I think.
Yeah.
That's the question. It's true that when we speak with the administration, in many times, they find that the possible partners that can come to the public procurement process, they don't know how to find good partners to go to the procurement process. I find it that it would be very useful to have tools to identify good partners to go to that public procurement process. Just to be able to obtain the final solution that can match all the needs of the public administration. Also, the third one, I find it very useful because it's true that there are many companies that don't know to have which administration has the needs of its technology. I have seen that in companies that develop biometric solutions that are willing to sell it to the administration, and they don't know how to find this administration. So I have.
That's one very good point. But I mean, my point is even not only that, I agree with that. But the point is that once you have identified, let's say, potential procurer, you don't normally, especially for SMEs, you don't know very well how the public organization really works from inside. So you may approach normally what they need owner, the person in charge of the service, who really will be willing to buy that solution. But this guy or the woman is normally not the one who is not a procurement official, and is not a decision maker, or is not the one in charge of budgeting or whatever. So it's not always easy for a provider to understand that once you get kind of fruitful conversation in which you find somebody saying, well, this solution is quite interesting. I mean, I would like to, it will be good to procure it. That's just the beginning of a very long process, right? Mm-hmm. So that's what I would call like internal customer, but I mean, with what you said, yeah.
Okay, thank you.
Yeah, and regarding the open market consultation, I mean, the how to identify with partners, one, let's say, tip or I mean, our approach in Silo when we developed open market consultation is always try to make them very, very interactive, meaning trying to have at least one public presentation in which providers can meet, can, like even creating networking, networking spaces and in the agenda, so that, let's say, a traditional large company, an incumbent, a procurer provider for that procurer can meet maybe innovative SMEs, digital or whatever, which are not so used to innovation procurement, but they do have a very interesting, technological solution, and trying to establish this kind of, or at least to promote the possibility to create these links and these partnerships, which are not easy to build. Yeah.
Thank you, Diego.
Thank you very much, Adrian. So I don't know
maybe if you want to speak about the 4, 5, and 6.
Sure. So the fourth one was the PPI tender has been identified at the same time by the commercial director and the R&D director. This is something that we deal with in Silo when we deal with very large companies. And I mean, it seems that you agree that it's very easy to align their interests. Our experience is that it's not always so easy. The thing is that innovation procurement is for those in charge of R&D departments who are usually, familiar with calls, with contract research, but not so much with tenders. They have to make an adjustment to get into the procurement, culture. While on the other side, you have the commercial or the marketing directors, and these people is very much used to direct procurement, and they want to provide, to sell what they already have developed. So they are not so much interested in tendering processes in which they have to, let's say, develop new solutions, because their incentives, their mandate is to sell as much as possible what the company has already developed. I mean, for sure, then there is a room for flexibility, and this is not black or white, but it is not always so easy. The larger the company is, it's not always so easy to align their interests. This is at least our experience when we work with companies and supporting them to approach innovation procurement processes. So number 5 was I know how to identify good partners. This is what we were discussing this following Adrian's question. And then number 6 was I know how to approach and negotiate APRs, and you mostly disagree with this statement, and I mean, I'm glad to see that, because at least from our experience, that's the case, especially with SMEs, very innovative and so on. They are very much used again to negotiate IPRs under the or within a project funded by core, again, framework program or whatever, with the university, technology center, this kind of organizations they are very much familiar with. But when they have to engage with a very large company, which is let's say a traditional provider of the public sector, it's not easy for them to negotiate APRs with these very big elephants in the process of the tendering process. So
sorry, Diego, for interrupt you. I would like to take advantage of those that what you are comment on to inform attendants that by the end of this year we will be organizing 3 webinars about this topic, this specific topic, how to manage IPR in the framework of this housing facilitator project. So please stay tuned, because this for sure this is a topic of high interest. Yeah.
Hot one, yeah, for sure. So I mean, if there is no further questions, we can move to the. I will stop sharing now, and I will go back to my presentation. Meanwhile, thank you for those that have voted, and please keep on doing it. Yeah, please. So now let's move to the provider's side. So please walk in the procurer's shoes now and try to consider that you are either public administration or a service provider. Let's consider healthcare service, for example, which is we are very familiar with that in the project, of course, or a public company which has a strong technical department, and you are used to large technology investment and projects. So again, strongly disagree, strongly agree, 1 to 5, and we have these 5 questions. Considering that you are, say, a healthcare service, the statement will be that the unmet needs identified by policymakers, by decision makers, let's say Director General or whatever, are very similar to those identified by the need owners, by those in charge of the providing the service, clinicians, and whatever, right? In this case, it is easy for me to again internally align priorities of the public service. So there is a lot of alignment here in the debate. It is easy for me to align the priorities of those again need owners in charge of the public service and those of innovation managers. Let's say innovation managers in the hospital, which is not dealing with patients and with not so much close to the end users. To what extent do you think is easy to align those priorities? And finally, to the service center, hospital entity, whatever, has these networking spaces, protocols, whatever that helps identify and promote innovation projects that like innovation committees or other, institutional arrangements that help identify the needs and shape projects, and identify the key elements of a future tender or a permanent consultation. So this would be the 3 first questions, considering you are a healthcare service provider, and then let's consider now that you are again a large public company, healthcare or the sector, whatever, and with a very strong technical department, let's say a public water supply company or a railway service company. Let's imagine a public company with a technology department and used to a large technology investment. Do you think you know how to design a tender that gives opportunity to startups and innovative SMEs? Let's say that being this very big elephant technology investor, you want to approach maybe hand in hand with an innovation agency to launch a PPI tender, and you would like startups and innovative SMEs to participate, and most probably they are not your incumbent providers. Do you think you have the tools and the knowledge to design such a tender? And then the last one would be that my technical staff from this innovation department is familiar with the administrative procedures of public procurement, because if they are, it would be more easy to design this kind of tenders, right? So these would be the 5 questions, and know, Liana, if we are getting.
Yeah, we have 5 people now voting, so we wait for a minute maybe. So the other 5
Come on, 5 more.
at least, yes.
Yeah. Again, we will.
Maybe Diana, you can share once again the QR code, please.
Yes. Yes.
Okay.
Yeah.
Thank you.
It's all the time the same
Yeah.
code, so you can keep the app open, so you can answer the next quiz also. We have 5 viewers. 2 more are voting now.
But let's share the 5 answers if that's what we have.
Okay. There were 2 people answering now, so we wait.
Yeah.
3 now.
Good. Very good.
Okay, now we have 8, so I think
Good.
we can share.
That's good.
Okay. So I will share my screen. Just give me a second. So here we have the first one.
Topic 1, unmet needs, very similar to those identified by need owners. Policymakers versus need owners, and mostly you disagree. Okay, let's go. Again, you disagree with how easy it is to internally align the priority of the public service with those of the innovation managers, which from time to time they fall in love with innovation projects that maybe are not so linked to the priorities of the service. Okay, 2 and 3. Service center, hospital, whatever has networking spaces and protocols. Yeah, I mean we are making progress in this, especially in the healthcare sector, but there is still a lot a long way to walk. Let's go to the end. I think I know how to design a tender, opportunities, and mostly disagree, somehow agree. Okay. And finally, my technical staff is familiar with the administrative procedure. Okay, that's very, it's not so clear who's the winner here. Very sad. Okay, so let's try now to try to play the same game. And is there anybody from the procurer, from the demand side, who would like to share their feelings about this answer? Do you again find this familiar? Do you these results correspond with your daily experience or not? Is there anybody from the procurement side willing to share? Yeah, please. Yeah. Thank you.
Thank you. Thank you very much, Diego, for your presentation. I know you've made us the question, but I'm a bit curious about knowing your thoughts on this, because as an expert that has been working in the public administration sector for some time, I'm curious to know what are your thoughts, and of all these questions, which one is maybe the one that you think is more challenging?
Yeah, sure.
Thank you.
Thank you very much. Well, I would say that for a public, administration, it's not always easy to align this the the political cycle and the needs identified by policymakers whose drivers are, the general policy objectives, public awareness, and of course, some of them are also very, very much needs of the citizens, but there are a lot of unmet needs having to do with efficiency, with processes, with the daily life of the public service delivery, which are not so familiar for policymakers. So, this tension between the public servant and the decision maker which is that's daily challenge of public sector. In terms of public procurement and innovation procurement, for me is one of the key points, because as innovation procurement is a complex process which takes time. We will get into that later on. It needs a kind of it always needs some let's say a sponsor, a political decision maker who is supporting the project. So the more, let's say, attractive, sexy, easy to sell project, the more the policymakers want to support it. So those projects are not always the same ones that a lead owner will select, but this sponsorship of decision maker is a key element to get through the difficulties that you are going to find along the way of innovation procurement tender. So that's why for me this tension between the decision maker and the lead owner is a key one. Then both of them have somehow to align with the of course the public procurement rules and the procurement officials, and that's another story. But for me that would be one of the key elements. I was very interested in, if you can go back to the third question, this regarding the protocols, networking spaces and so on. As we are getting no answers from the demand side. If any of those whose answers were 4 or 5 would share, why they are answering that. Do they have experience in dealing with, I don't know, maybe a living lab, experimentation space within a hospital or whatever, in which maybe as providers they were involved in this kind of co-creation processes, or I don't know, because this was good news for me to see that some of you were answering 4 and 5. I don't know if any of those who did answer 4 or 5 would like to share why they did so, because this is another step for me. This is also another key element, a way to align and to design good innovation procurement projects is to have this, protocols, this possibility to create multidisciplinary teams to shape and to put forward innovation procurement projects. So it is, let's say that within the healthcare sector, we are getting more and more used to these kind of arrangements, but they're not common at all in public sector at large. So does anybody? We're very shy today.
Yes, please don't be shy. Any of you who would like to share these or have thoughts?
That should be 1 or 2 people. Maybe they have a nice experience to share. No. Okay, but thank you anyway for participating in the Slido quiz. We will finish now. I will come back to my presentation, and we will get through the last, let's say, slides of this first part of the session, and this is very quick. A couple of slides to share our experience. Again, highlighting some of putting some more emphasis on some ideas that I already shared with you. I mean, we believe, this is our experience, that these innovative SMEs which are not familiar with tendering processes or with public procurement, they find it very hard to deal with procedures. They are new to this whole new, concepts or criteria, performance clauses, and so on. It is not easy for them, especially for SMEs, to build this sound strategy to approach a tender, because maybe the only way to due to the requirements of the tender, the only way to approach to the tender is to establish a consortium with a very big company, and that's not easy for them. Maybe the first time they do it. Again, this understanding who my real client is and who are their drivers is also not easy for companies who are new to the public sector. And then, from our experience, for those companies who are used to apply to calls, they are very much used to engage with the public sector, but always through calls and under the stated rules. It is not always easy to understand that public procurement, is a different world. Those companies are normally very, very much used to engage with public officials in a way which won't be proper to do it under the public procurement rules, right? So this is also something that we always emphasize when supporting SMEs. And then in the case of public officials, where we believe that they find it very hard to identify properly these challenges, these unmet needs, to turn those challenges and needs into a viable project. Maybe they are able to identify the challenge, but it is not easy for them unless they create this multidisciplinary team to put together a viable project. Again, these networking spaces, how to articulate them, not easy at all. To set up new administrative procedures, maybe it is the first time that you come across pre-commercial procurement, and it seems it is a good idea. We will come back to that later on. But if it is the first time you have to write a tender, let's say outside the common public procurement rules, as it is the case in pre-commercial procurement, that's something not easy at all, especially for innovation managers interacting or lead owners interacting with procurement officials. And finally, understand these business dynamics. How to, not because, of course, you are interested in particular in the participation of a specific company or a set of companies, but in general, understanding these business dynamics, the times they need, the incentives they have to participate or not in market consultation and tendering. It is not easy for public officials which are not have never worked maybe in the private sector or engage with private companies. So yeah, this is like summing up our experience on this topic. And finally, to end up or to finish the first part of the session, just a number of tips on how to design a PPI system, which was the point of this part of my presentation. We're going to do it around the procurement cycle, from the strategy design to evaluation, award, implementation, and impact, and just a number of tips that we believe are useful to at least try to narrow this gap of these two different cultures, the public procurement culture and the private procurement culture, this divide that was mentioned in the beginning. And let's make it, considering now that we are the contracting authority. So in the very beginning, I should bear in mind that innovation procurement takes time, at least 1 year, maybe 2 years if you are setting up a process, the protocol approaching innovation procurement is going to take a long time before you are able to award your first contract. So it's very very important to manage the stakeholders' expectation, especially for the providers. This is one of the main lessons learned around this the whole experience of silo. And we've been working together, many contracting authorities that were kind of marketing the new projects and selling these projects to the public and to the potential procurers very early, and this in the end created a kind of fatigue, within the providers. So number two is that PPI is complex, as I said. So you do have to invest in training, and for sure you have to build up or to set up some permanent innovation procurement capabilities inside your organization. But before doing that, it is a good idea to take a moment to think about which kind of capabilities you believe you are going to need in the long term, and which ones you can outsource to consultancies or whatever. You are getting maybe your first innovation procurement project, okay? You don't need to know everything since the very beginning. You also can get support from external consultants, experts, even from a regional innovation agency or a competence innovation procurement centers in case you have one in your region or in your country. But you do have to ask yourself which kind of capabilities you would like to have, because you have to build them. You have to invest in training, as I said, maybe hiring people and so on. Then, in case you are approaching or you are designing your first project, don't set the bar too high. Don't go for the very challenging, maybe sexy and very easy to sell project, but very difficult to run. Right? Let's start with a pilot, which maybe is not such a big one or such a sexy one, but to have the ingredients for success. Committing managers, sophisticated contract authorities, to have the funding or whatever, right? The fourth one is something that we always emphasize. Don't try to save time in open market consultation. I said before that it may take 1 year or even 2 years to get to the proper tendering process. So it may take 6 months, 9 months even, to get to the open market consultation stage. So in that moment, normally you may feel anxious. You really want to push the project, and you feel the temptation of trying to save time. But from our experience, there is a trade-off. All the time you think you are saving in making quick or running very quick the open market consultation, it is the time that you have to invest in the future when writing the tender or even when managing the contract. So please don't try to save time in open market consultation. They are a very key element for success in innovation procurement. Right? Then again, capacity building. Install this capability, routines, procedures, standard specifications, IPR management. Hopefully you get into your first project thinking that it's not going to be the last one. So once you have decided which capabilities you want to have inside, let's go to procedures, to standard documents, specifications, IPR, let's say, model within your organization. Everything that you take advantage of your first project to install those capabilities, that will be an investment that will pay off in the future for sure. And then 1 year, 10 months, 1.5 years after you started with your wonderful idea, with whatever co-creation workshop within your organization, trying to launch your first innovation project. Finally, you are in number 3 or 4, and you are launching the tender. You have evaluated your tender, and you have awarded the contract to a project and consortium or whatever. So you may feel so exhausted, feeling that finally, it's like the beginning of the end, no? Like Churchill said, no, the beginning of the end. No, it's really the end of the beginning. You are really, now is when it all starts, right? And this is also something very important, especially for innovation managers, which maybe are not so familiar with procurement processes, and they are more familiar with, problem solving and co-creation techniques and how to, write a very good project. But this is a tender, so you are the owner of the project, the company. This is not a grant. So you are the owner, and you will be the owner until the very last day of the project. So that's something you have to keep in mind, and also something that may be difficult for a provider if it is a newcomer to public procurement. Okay, and then of course learn for the future. You have go through the whole cycle. Take some time to make a kind of evaluation and to reflect in around the project. What did you learn, and what would you do different in case you get into your second innovation procurement project? That's of course like a must, right? So take some time also for evaluation and learn some lessons of the experience of your first PPI project. Well, that would be the first, I think we are more or less in time, that would be the end of the first part of the program, of my program, let's say. Then I will pass the floor to Antonio and the rest of the team. But then, now we are going to get into the second, the second part of the agenda on award procedures. So we are going to discuss pre-commercial procurement, public procurement of innovation partnership, and so on. But again, instead of going through a number of slides and concepts and like a very dry presentation, I've tried to make it also participatory. So now I'm going to ask all of you, so both providers and procurers. We're going to go through yes/no questions, right? In 3 blocks, and I will, after those questions, I will get into the pre-commercial procurement and the procurement of innovation and innovation partnership, right? So please get into the slide once again. Same code, I believe, and we will go into, we'll split it into different blocks, right? 3 blocks, so two and 2 questions. Let's go first with these 2 ones. Again, to be answered by all participants, both demand and supply side. The first statement is that I believe that, as in any public procurement, in the case of innovation procurement, there can be only one awardee, right? A single company or a joint venture, because this is the standard procedure of public procurement, right? Well, you have to answer yes or no. And then the second one is, does innovation procurement require awardees, future providers, to work always in collaboration with R&D centers or universities? That will be the second question, and again a yes/no answer. Diana.
Okay, I will share my screen. I see some people answering now, so I'm going to try another way to share it so it's better. Maybe we have 3 people, 3 answers, so we wait a minute. Yeah. Okay, we have 8, so maybe we can share the results. Ready? I don't know why it's not working. It's not working. I will do it the other way. Sorry. So
It is okay, like we did it.
Yeah.
last time.
we have it now.
Good. So I believe that in any public procurement, there can be only one awardee, and the second one was that procurement requires always to work in collaboration with the Central University. So the question, let's say the right answer to the first one is that is no. We will get now to the pre-commercial procurement, which is procurement, let's say innovation procurement procedure or award procedure in which there can be more than one provider. We will get into that. And then the second one, well, the thing is that we will get into the PPI in public procurement of innovation. You don't need to perform R&D. And even in pre-commercial procurement, while you have to perform R&D, you can do it by your own. I mean, it is not needed to do it with an R&D Central University. The truth is that in many cases, the best way to approach pre-commercial procurement is to do it hand in hand with an RTO. That's right. We will see that pre-commercial procurement is best suited for low TRRs. So it is very often we do have these kind of consortiums, right? Innovative SMEs and RTOs, but it is not a must. It is not a mandate or requirement of the process, right? So going back to my presentation, this is the pre-commercial procurement slide, in which, as you may see, it is not, let's say, traditional, if we can put it that way of procure a solution. In fact, see the note below, it falls outside the government procurement Water Organization Agreement and the public procurement directives, because it is true that under public procurement you only have one awardee or a consortium. If you have different lots, you have one awardee per lot. But in this case, you may have different suppliers, different awardees, which work in a kind of competition, right? They are working with different technology alternatives. So it is several competitive suppliers which work with different alternative solutions through different phases. You have here in the slide 3 phases, because this is the most common procedure, and it is how it is established in the rules of participation of the framework program. But you may do it in 2 or 4. I mean, there is not a mandate under the EU directive or the different procurement, let's say, laws in the different countries. But I mean, 3 phases is a very common. In the first one, you work in the solution design, then the prototype development, and in the end, you make let's say a proper testing of you end up developing a test product. But it is a test product. It is not a commercial product, which is the case of public procurement innovation. We will get into that now in a few minutes. So the thing is that under pre-commercial procurement, which is a good idea when you really need to de-risk the technology, and you don't want to tie your hands to stick to a specific solution or supplier, because there are many solutions being produced. There are no commercial solutions for the challenge. So it is indeed a good idea to work with different suppliers in this kind of competitions, in which only some of those who participated on phase 1 get into phase 2. There is like a gatekeeper, the set of criteria to be fulfilled. So just a number of them get into phase 2, and again, only if the prototype performs according to the specific characteristics and requirements that were written on the pre-commercial procurement document or tender, so to say, they can get into phase 3, right? So we may end up in a tender in which nobody gets to phase 3. That's okay. in which many companies get into phase 3, that's also okay, in which only 1 or 2 or whatever gets into phase 3, and then we have to check if either, in this case, in the case of the slide, the supplier B or D, they really are able to produce a kind of advanced prototype, a test product, which really fulfills the requirement, right? But in the end, it is an R&D contract. So you are paying the procurer to conduct this R&D process under a contract. That's right. It is not a grant. It is a contract, but it is very much like let's say the user experience for the company is very much like having a grant, in the sense that they pay you for the R&D that you are performing with these different phases. So it is only a good idea in case that, as I said, there are many competitive solutions being produced in that moment. The technology readiness level could be between approximately 3 to 7. So let's say low to medium TRRs. The public sector is still in the development of technology, right? And to collect info about pros and cons of the different alternative solutions, because in the end, they only get the first, let's say, very limited volume of test products, or just one product or a solution to, as I said, test if it really works, right? It is not a commercial procurement. That would be the case of PPI. We will get into that after the new set of questions to make it again more dynamic. So please, again, both demand and supply side, do you believe that as it is innovation contract, do you believe that the public buyer understand that always the prototype of this solution may not work? Okay, we see that in the pre-commercial procurement, but is this also the case of innovation, of public procurement of innovation, of the second type of award procedure that we'll get into that now? So it is always the case, because we are discussing innovation, a new technology may work or not. So is this the case always in an innovation procurement contract or not? And then, do you believe that the innovation procurement procedures follow exactly the same scheme in all member states, that according to the European directive that has been responded to the different member states, the transportation process? Or may we find different flavors and different details on the procedures in every member state? And that would be the second question.
I will share my screen now. Yeah, so I'll give you a couple of minutes to answer. Four already.
Already. Thank you so much for the participation. It's very, very valuable for us. Maybe we can,
We show the results already. Okay. So I will do it the other way again. So.
Okay, so you answer mostly yes to the first question, while let's say the right answer, if we can put it that way, would be no, meaning that that's the case of pre-commercial procurement. I mean, it was a tricky question. I mean, that's part of the game. Of course, in the pre-commercial procurement, that's the case. I mean, you are procuring a prototype, a test solution. There are many competing technologies, and as I said, this was kind of a tricky question. It may not work. That's part of the game, and the SMEs, they get paid for what they have developed, as in the grant, so to say. But the case is that that's not always the case in innovation procurement, right? We will get into innovation and public procurement of innovation, high TRRs, and in those cases, it do have to work, right? And then the second question would be mostly no. That's right. I mean, the directive is of course a EU directive, so all the member states have to go through this transposition process in which they develop their own public procurement act or law. So it's following the same rules, but there are different, as I said, different flavors, different details. And you can find this mostly if you check, maybe not so much the law, but the public procurement guide. In fact, I will get right into the slide. In fact, this is the case of, the source of this slide is the European Commission, and this is, as I said, the case of the framework program and the rules of participation, and how the Commission in the rules of participation states what is pre-commercial procurement and what is public procurement of innovative solutions. As you see, it has to do with the deployment of commercial volumes of end products. So you are really buying or procuring a solution that has to work, and if not, you get a penalty. So this is according to the let's say the classical, so to say, approach to public procurement. But you see here again, following the European Commission, let's say, doctrine, that the solution is almost on the market or already in the market, but in small quantity, but not meeting requirements for a large scale deployment. So that would be, in fact, technology readiness level or 8, right? So just one step below 9. This is not the case, for example, in Spain and in other EU countries, right? Where we understand that public procurement of innovation, well, maybe you don't need to procure R&D, that's right, but you do have to perform innovation activities, not only certification or just scaling up a product which is already in the market in a small quantity. So this small quantity issue is one of the difference between how the European Commission understands public procurement of innovative solutions and how, in the case of Spain, let's say the manual or the public procurement of innovation guide set, let's say, the rules of innovation procurement in Spain. So there are these small differences. So this is the public procurement of innovation, sorry, the public procurement of innovative solutions. That's the second type or typology of PPI, in which again you do have to deliver in the end and within the contract, scope of the contract, a commercial solution and a product, right? Opposite to pre-commercial procurement, in which again you are just working on the prototype or the test product prevention, so to say. Okay, so that would be PPI, and then we will go through the last two questions and the last slide of my presentation on the innovation partnership. Do you believe that this should be easy now? PPI, let's say an innovation procurement project in general requires always undertaking the activities. Do you believe there is a way under the legal framework to get, let's say, the best of the PPI and the PCP? Because if you consider pre-commercial procurement, it seems like a very good idea that you are, procuring solutions from different providers, and in the end you get, let's say, to the best of those who entered in phase 1. That looks like a good idea, to have different companies with competing solutions, but in the end you cannot procure a commercial product or a high volume of products, right? Just the first, a limited volume or a test product. And if you want really to engage in a contract in which you you end up buying a commercial solution, and you can really engage with the provider in a way in which the provider has really developed, is committed, and has a contract in which they have to develop a commercial product. That would be the case of PPIs. So the question is, do you believe there is a way to kind of make the most of both procedures of PPI or PCP? Have you ever heard of the way to do so? That would be the second question.
I will share my screen now. We have 3 answers. One more voting now.
Yeah, we can.
Yeah, we share. Okay. So here we have.
Yeah. So very good. Now, most of you, there was somebody who voted for yes. Again, in the pre-commercial procurement, let's say, award procedure, yes, you do have to perform NRT activities, competing technologies, low TLRs. So that's the case. But again, on the public procurement of innovative solutions, you don't necessarily have to perform the activities, right? You may have a product or very close to what is needed, and you don't have to perform the activities. And very well, yeah, mostly we have yes answers to the second question, because in fact we are gonna now get into the innovation partnership with this award procedure, in which you can really kind of make the most of or get the best of the two, of PPI and PCP. So that would be right answer would be yes. My final slide has to do with innovation partnership, which is let's say award procedure that was introduced in the 2017 directive, sorry, 2014 directive, and it is a way to as I say, make the most of the two processes, right? So in those cases in which you do need to procure a commercial product, but you feel that let's say that the technology, following what you have learned in market consultation, technology is maybe, let's say, 6, 7. So you believe that with a very well-oriented R&D process, different companies could get to not just the test product, but the commercial product with really commercial value. In that case, you may, let's say, use the innovation partnership approach, in which you, as I said, you launch, let's say, a tender in which, in the end, you are going to procure a high volume of services, products, commercial. They do have to work, but in order to select the provider, you kind of establish a competition, let's say, a PCP-like competition, in which several companies work in development prototypes ready to be tested as test products, and award the contract, let's say the commercial contract, to the best prototype, so to say, right? So it is a way to combine like both. This is not right from the legal point of view. It's like combining. Like compete in a PCP and get a contract like in a PPI, as you may, as it reads in the slide, right? So this is the innovation partnership. It is not, you may imagine, an easy to run procedure. So our recommendation would be always not to get into innovation procurement through innovation partnership, because you have to be very precise in the open market consultation, because I mean, if you get into a position in which in this competing phase, you end up with no provider, fulfilling the request of let's say this test product in order to get awarded the whole set, the large volume of service or products, you really are in a kind of a mess, right? So these projects needs very a long process, a very long and detailed open market consultation. But if that's the case, if it is a complex project in which you feel you are in that position, it's a very useful tool for sure, right? So it's just we wouldn't recommend that your first project would be an innovation partnership, but it's an award procedure which is there to be used in the proper cases, right? So that would be my final slide. And I mean, of course, if you have any final questions, anything which was not clear, or that you would like me to come back and go through it, I'm very much open to that.
Yeah, we invite you to ask now, as we are changing now the speaker after the break. So you have any questions, you can do it through the chat or just open your micro and ask them.
Really, we are on time, right?
Yeah, well, very good. Yeah, the break was scheduled at 10:45, so we are on time.
If there is no questions from the attendees, I would like to ask you about this last type of innovation tool, the innovation partnership. Which will be the TRLs that will cover this kind of process?
Yeah, it will be probably 6, 7. I mean, the thing is that the competition phase usually runs for a few months, so it's very difficult for me to see or to find a project in which starting below 7 you can really get into 8 or 9, so to say, in order to be able to buy the commercial product or service. So it will be most probably 7 or 8. I mean, there is no rule saying that you have to be in a particular, but this is a very practical experience, right? So it will be 7 or 8, depending on the kind of technology.
Okay, thank you. Any questions from any of the participants? No questions? Okay, anyhow, if you make any questions before this slide, please chat in the box, and then we will try to replay you offline as Diego Muñoz will leave us, and we will move to Antonio and Diana for the last part of the meeting. Okay, let's make now a brief
Thank you
break.
very much.
Okay, and we will see you at 11. Okay, please do not disconnect. Please just turn off your cameras, your micros, and we will come back in 15 minutes. Okay. Okay, thank you very much, Diego, for your presentation, and see you later then.
Thank you. Thank you, everybody.
Okay, let's go back. We will give a couple of minutes more for those that have extended a bit more the break. Okay, and then I think that we can start with the second part. Okay, let's wait. Okay, a couple of minutes of courtesy. I think it's time to we'll start with this second part of the workshop. Now we can with our colleague Antonio Guivarey, manager at Zillow, that will give us some information about how to manage a PPI process step by step, and also with Diana that will inform us about some training resources already available through the Health Innofacilitator project. So the floor is yours, Antonio. You can start whenever you want.
Thank you, Raquel. Good morning, and thank you all for joining us today for this workshop on public procurement of innovation. I'm going to share my screen. Can you see my screen?
Yes, we can.
Okay, lovely. Okay, so this part of the workshop is going to be a brief resume about the different steps that you are going to follow within a PPI project. We'll try to put together the perspective of a public entity and a private company or an R&D institution that wants to execute the project and develop innovative solutions. We already made the presentation, so I'm going directly to the content of this presentation. So our intention with this content block is to introduce the guidelines that you can take as inspiration from in order to promote public procurement of innovation. Therefore, we'll review the phases linked to PPI projects, and we'll see lessons and tips taken from real projects that we execute during our experience. We'll link each phase with relevant materials available on the Innofacilitator project website, and that's the part of my colleague Diana. And in my case, I'll structure these contents into 6 sections. As you can see, a brief compilation of the context of PPI projects in case some of you joined to this part of the workshop. Then some best practices to follow before starting a PPI project. Some best practice that we think can be useful to have a general perspective of how to approach PPI as opportunity both for public and private entities. And then a general overview of the different phases linked to PPI projects from a broad perspective, and a closer view of each phase, planning, execution, and evaluation of results. Okay. So some key concepts to ensure that each of you have a general perspective about PPI before going deeper, in case you join us in this part of the workshop. As we explained before, my colleague Diego, PPI is a public procurement approach within the scope of the public procurement directive, in which a public entity stimulates the development of innovative solutions, can be products or services. Even both parts of are available within the PPI scope. It's a process where public entities act as early adopters by acquiring goods or services that are not yet available, but can be developed in a reasonable time. Let's say between 2 and 4 years is a reasonable average time for a PPI project. And then, of course, after the project is going to come the part of certificate those solutions and large-scale market in order to put those innovative solutions within the market available for our stakeholders. Well, the main objective of PPI is to improve the efficiency and quality of public services while promoting innovation as an economic and social objective. Therefore, PPI has benefits for both sides, public sector and private entities. From the point of view of public sector, you can take advantage of the innovative capabilities of the different stakeholders, and from the perspective of a private entity, you have an early adopter of innovative solutions that are risky, and without this opportunity, maybe it's difficult to find funds to develop those solutions if there is no clear market for them. So there are benefits for both sides. Well, before engaging into the different phases, we think it's important to have a general perspective of how to approach PPI as an opportunity for both sides, for the public entities and private companies. And then as a first step, we can take a look to some key elements that we recommend to consider before starting a PPI project. This part is from the perspective of a public entity. Then we are going to show the equivalent topics from the point of view of a private company or an entity that is focused on research and development. In this case, we consider that it's important to perform an internal assessment. So think a little bit about your organization, the situation of that organization regarding PPI, the needs of training that you may have in order to take advantage of this opportunity. If your organization has a structure that is the best to fit with this kind of projects. This kind of projects implies different stakeholders within your organization. So maybe it's different from the usual approach where each department has its own projects. And maybe you need to hire external advisors. And all these things are part of the internal assessments that we recommend to perform in order to get prepared and then execute a PPI project and maximize the opportunities of having a successful project, and not only a singular project, but with this approach, have the opportunity to define a strategy and approach PPI as an opportunity that you can deploy continuously over the time if you get the proper capabilities and the proper structure, and you define a person that is going to be responsible of monitoring that part of the organization, the execution of PPI project that have linked the identification of unsolved needs and then the iteration with the market until we have the information to define a regulatory document to hire those services. Then Another part that is also important is the part of identifying cost-saving opportunities. PPI is not only about saving costs and improving services. It can also be linked to deploying new public services, but it's a good starting point to think about cost-saving opportunities for the organization and the mechanisms to evaluate the cost through all the life cycle. It's not only the cost linked to investment or initial development, but also think about the cost that you can save in the future when that solution is deployed in your organization. And if you think about this perspective before engaging in a PPI project, you can start from the perspective of which services have the biggest costs and which services have innovative solutions that can reduce those costs. And with that perspective, you can save funds to even continue this approach of introducing innovation in your organization. Another perspective that is another dimension that is important to consider is the internal stakeholders and strategic areas. Of course, you have to take a look to your strategy as organization and try to link that strategy with the opportunity that represents PPI. And if you have an innovation strategy, PPI can be an opportunity to deploy that strategy. And if you don't have an innovation strategy, it can be an opportunity. PPI is an opportunity to define an innovation strategy and deploy that strategy, taking advantage of PPI procurements. There are also legal considerations. Regulatory documents are a little bit different when you deploy a PPI project because normally intellectual property rights, for example, is not something that is usually regulated with detail in a standard contract. It can be the case, but sometimes is not the case, and is a key element of PPI project. Only to mention one aspect. Another aspect can be the approach. We normally define what we want to acquire. If we want a car, for example, we are going to describe in a standard contract how it should look, that car with characteristics, and we specify in detail how the car that we want to acquire is supposed to be. In PPI, the approach is totally different. We specify a mobility solution with some functionalities, and then we normally give room to different approaches. So you have to think about a different perspective also from the point of view of how you specify what you want. Maybe you need external advisors that are that have experience in this field in order to adapt your standard regulatory documents to the perspective of PPI. So that's an important dimension of PPI project that you have to consider before engaging in this kind of procurement. And last, we have state aid compliance. There is a specific framework for state aid in the area of research, development, and innovation. And that framework established that there are certain conditions when PPI projects are deployed outside the regulatory framework of public contracts. That's especially the case of pre-commercial procurement. And in those cases, you have to consider special conditions, like, for example, the terms which apply to third entities in order to access to the intellectual property rights that are derived from the project. Well, you have to ensure a fair access to those IPRs. So that's only a specific example, but there are other considerations regarding the market price of research and development services, and all those restrictions are relevant because are necessary to comply with the state aid regulatory framework. And from the perspective of public entities, it is also important to consider the three main official reference documents that we have regarding PPI, the guidance on innovation procurement, the public procurement directive, and the communication from the Commission regarding the state aid framework for research and development and innovation that was updated last year. So those three reference documents are the main reference that you are going to follow within the PPI framework from the public perspective and also from the private entities that want to take advantage of this procurement. Then we are going to take a look to the equivalent perspective from the side of a private entity. We think that it's also important to integrate PPI as a strategic opportunity for all kinds of stakeholders, including private entities, from the perspective of aligning your innovation strategy. So if the company has an innovation strategy, and if you are interested in PPI, I'm sure that's the case, PPI should be integrated as an opportunity area for funding new products and services. And I would say that this appropriate to assign a person in charge of the design and monitoring of this strategy. And also it's important to have realistic perspectives and realistic objectives regarding PPI. As Diego told before, PPI projects take a long time to design and execute the project. So it is important to have a realistic perspective from this side. It's not an opportunity for short time development of projects. It's more an opportunity for medium to long term innovation strategy. So taking into account that perspective when you define the objectives linked to PPI as opportunity. Then, of course, you have to prioritize areas of opportunity, identify the PPI project, the profile, the type of client, the potential collaborators that you can join you, that can join you in this kind of projects and best fit with your strategy. This will allow you to focus on commercial efforts and be proactive. You can be proactive in the sense that you can approach your usual clients if you are already working with public entities and try to promote the profile of project that best fit into your strategy, your innovation strategy. So it's also important to be proactive and evangelize, that is the third part, and position yourself, approach proactively public entities that you have prioritized and engage them into PPI projects. At the same time, you can show your capabilities from the point of view of innovative developments and ensure that you have a certain degree of influencing in those public entities. That is something that is fair to show your commercial capabilities and innovation capabilities and tell them that the PPI is also an opportunity to hire innovative solutions. And then, of course, establish a monitoring framework. So set objectives associated with PPI projects and monitor how your efforts evolve and how you meet those objectives, making sure that you have a realistic perspective. And from that point of view, PPI, once again, is a long-term opportunity. And it's important that those indicators that you use as a reference when monitoring PPI opportunities cover everything, each part of the PPI process, from the initial business approach and commercial contact to the final commercialization of innovative solutions. You should make sure that you cover all the phases to identify where you can have troubles going through through the different phases of a PPI project. And then finally have realistic expectations. That is something that we already stressed several times, because PPI projects are becoming more common, okay, but they still represent occasional opportunities from the point of view of public entities. So you are not going to find a lot of PPI projects coming through that fit with your specific area of expertise. And of course, as an innovation project, you will have results from the commercial point of view in a few years. So it is important to take a look to your innovative solutions, your strategy, and identify opportunities for looking for 2, 3, 4 years in the future. So that's the perspective of a private entity. And then we are going to see how we can divide the different phases of a PPI project. Well, we can divide a PPI project into 4 main phases. The definition of the strategic framework, well, you can perform this phase if you want to approach PPI as a strategic opportunity, if you only want to approach PPI as a specific opportunity because of you have a specific funding opportunity, or maybe because you only want to promote a kind of a specific experience in order to see how this works. You can approach directly the procurement planning phase, that is thing to promote a specific project, then the contract execution, and finally the evaluation of the results. If you have a strategic framework as a reference, it is good to include PPI as an opportunity and yeah, have that perspective. On the other hand, procurement planning will include all the activities specific link to a specific project. For example, you identify your needs, you make sure that those needs are not covered by market solutions, then you approach proactively market stakeholders in order to gather information to define the regulatory documents. And then once you end the procurement planning and you have a clear perspective of how you have to contract those services, you approach the execution phase that starts with the stakeholder selection, and then you go through the execution phase that have different parts in order to make sure that the project is oriented to your objectives as public entity. Well, it's not strange to take between 1 and 2 years until you can publish the regulatory documents. It depends on the complexity of the project, but it's normal to spend between 1 and 2 years between the strategic framework and the tender selection and the elaboration of the regulatory documents. Then the average duration of the execution part of a PPI project can range from 2 to 4 years. Again, it depends on the complexity of the development that is needed to get the innovative solution, but between 2 and 4 years is an average period that we can take as a reference. As we said before, during the execution is normal to have different solutions running in parallel. It's an approach that is good from the point of view of the public entity because you can test different approaches of the same problem, and you avoid to get limited by a single provider. If you only have one solution, you are going to depend on that provider in the future. You can, of course, you can negotiate the access to those licenses, but in some projects it's going to be complex to avoid getting linked to that provider in the future. So it is also good to have different entities working on parallel for the same challenge. And finally, we have after closing the project, the evaluation phase that has a perspective from the point of view of contract compliance and the point of view of the degree of success in the result that we take from the project. Those dimensions are separated from the point of view that a project can comply with the contract without achieving a successful outcome. So that's important because from the point of view of a private entity, you have to you will like to join this kind of projects if you can fail without having troubles from the point of view of the contract. So as Diego told before, it is important to include this evaluation as a separate dimension. So the contract is evaluated separately from the outcome. That's not the case in standard contracts, because in standard contracts you are supposed to give what the public entity wants to acquire, but in innovation procurement we integrate the risk that is intrinsic to innovation activities within the contract, and make that, if you make that clear in regulatory documents, you are going to avoid the legal problems if once the project is executed, the result doesn't achieve the level of functionality that the public entity established as objective. Well, if we go deeper into each phase of the execution of a PPI project, from the procurement planning to the evaluation of results, in the case of procurement planning, during this phase, public entities identify unsolved needs, as we specified before. Taking those needs as reference, it is advisable to conduct a proactive market analysis to determine if that need is not solved by the market. And then if you don't find any solution in the market that fits those needs, then you can perform a proactive open market consultation. And with the results that you get, the information that we get from that consultation, you can define the objectives of your project and elaborate the regulatory documents for the procurement. One key aspect of procurement in PPI projects will be selecting the appropriate PPI modality based on the feedback that we get from the market. Depending on how mature is the technology that we are going to use as base for our project, we can select pre-commercial procurement or innovative technology, PPI. So it depends on how close to the market is the solution, and those solutions we are going to gather them within the market consultation. That is a key element of the procurement planning phase. Normally, we can think that this phase can range from 8 to 16 months, more or less. It depends on the complexity of each project, and also if we are using a funding source that has specific constraints or whatever. So it can depend on the conditions of each project. If we go to the execution of the contract and the tender selection, well, this phase implies to publish the regulatory document, and well, you receive the proposals, evaluate those proposals, and select the suppliers that best fit with the criteria that you establish in the regulatory contract. And then you sign the contract. The project execution can imply different stages. and you can evaluate all suppliers on each stage and establish a filter. So you can start with 3 different suppliers, and then after the designing phase, you can select 2 of them to perform the prototyping phase. And once they develop the prototype, you can evaluate that prototype from a functional point of view and maybe select one or select one or both of them, depending on the level of performance. And at each stage, you can take go or no go decisions regarding each development that you have in parallel. Moreover, depending on the contract modality, especially in pre-commercial public procurement, it is common to have different deployments in parallel, as we explained. This phase normally takes from 2 to 4 years, depending on the type of PPI procurement and also the complexity of the research and development activities that are necessary to deploy the solution. Finally, we have the evaluation of results. In this phase, public entities evaluate whether the products or services meet the objectives of the project. And in addition to the performance of the results, you may have to meet with specific requirements coming from the funding source in terms of communication, maybe in terms of key performance indicators. It is important to integrate all those perspectives into your project. And from the point of view of key performance indicators, of course, define smart indicators with specific, measurable, attainable, relevant, and time-bound perspective. So if you integrate that perspective of key performance indicators, beginning with the open market consultation, you are going to define correctly the regulatory documents. All the entities that are involved in the process will know how you are going to measure the success of the project, and then everything will be clear and it will be easy to decide if the results meet the expectations and if the supplier complies with the contract that was signed. That's why it is important to differentiate between the execution of the contract and the fulfillment of the project innovation objectives, as we told before. The evaluation process can range from 1 to 3 months, depending on the complexity of the projects. We have to stress that, of course, as you can have different phases within the execution of a PPI project, you can perform an evaluation in any of those phases. So it's not something that you only perform at the end of the project. You can have partial evaluations, or you can evaluate different parts of the execution of the project, and is recommended to do so, because you can keep control of how each development is evolving. Well, in this table, we summarize the perspective of the promoting public entity of a PPI project, and also market agents that are interested in joining this opportunity. In the planning phase, as we can see, the public entity objective will be to validate that the identified needs are innovative and can be addressed by market agents. Additionally, they will gather the information that the public entity needs to define the regulatory document. This is a big difference between a PPI project and a standard procurement project. From the point of view that you normally start a PPI project without knowing how to specify what you want to contract. So you go to the market and you iterate with the market in order to understand the perspective of what market agents can offer you. From the point of view of private entities, or in general stakeholders that want to perform those innovative developments. They will need to position themselves for future procurements by submitting proposals for innovative projects. On the other hand, once the regulatory document is published, they are going to read carefully all the terms and decide if that opportunity is attractive or not, and take a go or no-go decision. That part is very important because within a PPI project, public entities regulate how to share the output of the project and how risks and profits are shared about from the point of view of public entity and the suppliers. So you have to decide as private entity if that's an attractive opportunity or not. And it's important to share that perspective within the scope of the market consultation. So the public entity has all the information to define an attractive set of regulatory specifications. So, for example, from the point of view of royalties, how much you have to pay the public entity in order to keep the IPRs, how the access of those IPRs from the point of view of third parties is regulated. All those details are important and are part of the business case of the private entity. In the execution phase, the public entity will monitor the relevant dimensions of the project through a tracking framework that include key performance indicators. So it's a way to ensure that the alignment of the project meets the objectives that were set at the beginning. And from the perspective of private entities, suppliers will carry out a project management strategy to keep control of expenses and also to prepare future stages of certification and commercial selling of those innovative solutions. So from the private perspective, you have to make sure that you keep control of your costs and also that you are prepared for what is going to come before closing the PPI project. And finally, in the evaluation phase, the public entity will conduct two types of evaluations, as we said before, one related to contract compliance and the other one from the point of view of the performance of the innovative solution. As we said before, again, it is important to have the perspective that we can fail from the point of view of meeting the performance that the public entity established as objective, but you can fail without failing in compliance with the contract. So those are different dimensions: compliance with the contract and meeting the expectations from the point of view of the functional performance of the development. And of course, after the project is closed, from the point of view of the supplier, they have to report the intellectual properties that were generated within the scope of the project and conduct their own evaluation of the results from the point of view of their internal business case, because the results can meet the functionalities that the public entity wanted to as a solution, but maybe is not as successful from the point of view of the business case of the private entity. So the private entity can have their own criterion, their own key performance indicators that are internal from the perspective of the future commercialization of those results. So next we are going to go deeper into the tasks and key elements of each phase, starting with the procurement planning, providing examples and online resources that you can use as guide when implementing these tasks. Regarding the procurement planning, as we can see in this slide, there are 6 key tasks that can be identified. Well, the identification of needs that are not solved by available market solutions, the proactive market analysis, the market consultation that comes after the initial market analysis, the formulation of specific project objectives, and then, defining the most suitable procurement modality, and prepare the regulatory documents that regulates the relation between the public entity and the suppliers. Okay, if we go a little bit deeper into each task, the identification of needs. Need identification is the process of determining what needs a public entity requires, of which solutions cannot be found in the market. So unsolved needs that have this public entity. This could include identifying areas where innovation could improve efficiency or effectiveness. And you can also think about products or services that can allow you to deploy new public services. So it's not only about improving the efficiency of existing public services, it is also about new services that you can deploy with innovative solutions. And that's an important and challenging perspective in PPI. Some entities restrict the PPI projects to efficiency or improvement of existing services. And if you are creative enough, you can think about new services and try to think about what new solutions are needed to deploy those services. And that's the most innovative perspective of PPI projects. Of course, it is good to perform a proactive market analysis, because this way you can make sure that the needs that you identify are innovative, and also to approach the open market consultation with more information, and then improve the iteration with specific market agents. That is aligned with the Chapter 3 of the Public Procurement Directive, that has a specific information about how to perform preliminary market consultations within the scope of PPI projects. And then we have the perspective of the how to formulate innovative objectives. Once you have information about the solutions that can be available in the market with enough time and proper research and development activities, you can set your objectives, realistic objectives, because you have that information from the market, and define the functional requirements that are linked to those innovative solutions. And also taking those functional requirements, define specific key performance indicators that are going to measure the successful of the project on each stage. The procurement strategy is an important decision regarding regulatory document elaboration, and is related to the type of procedure. It can be a public procurement of innovation from the point of view of purchase and innovative technology, or it can be a pre-commercial procurement. There are also innovation partnership, that is the most complex procedure from the point of view of putting together the part of research and development, and then the part of innovation until having a commercial solution. So this decision depends essentially on how close to the market are those solutions that stakeholders shared with us during the open market consultation. And finally, once we have everything clear, once we have what we want to contract, once we have a clear perspective of what the market stakeholders can offer us, we have to define the regulatory documents with all the specific aspects that we have to regulate, from functional requirements. If we normally allow variants that are different approach to solve that problem, we regulate the intellectual property rights. That is an essential dimension of PPI projects, and depending on the modality of PPI contract that we are elaborating, considering different suppliers working on parallel with different phases of evaluation and selection. So again, it is important to stress the difference between the proactive initial market analysis and the preliminary market consultation. There are different tasks that have different objectives. And the first one is to make sure that your needs are innovative, and also to gather information to define correctly the market consultation. Because if you go to the open market consultation without information about the state of art, that market consultation is going to take a long time, and the stakeholders are going to have a difficult time trying to understand how they can meet your expectations. So if you have a previous work iterating with maybe external consultants that give you advice on how to approach that proactive market analysis, you are going to have a successful preliminary open consultation for sure. And now my colleague Diana is going to show you some relevant online resources linked to the procurement planning and all the concepts that we share with you in the previous slides.
Thank you very much, Antonio. Hi, good morning to all. My name is Diana. I'm senior consultant at Silo, and I'm also a member of Innofacilitator working team from Silo. As it has been mentioned before, Healthy Innofacilitator aims to create a community leveraging capabilities and promoting innovation procurement in healthcare services. And for that, as part of the deliverables done within the project, we have a website available that Silvia already talked about at the beginning of this workshop. And I wanted to do like a brief introduction to this website, where you can find a repository of resources with several resources available about the PPI instrument. So next slide, please, Antonio. In this repository, you have a capacity building catalog with 30 resources available. And this catalog is under continuous updating, so we are not going to stop here. We are going to have more resources in the following months. Each of these resources have been classified based on several criteria, such as the type of resource, distinguishing between training materials, guides, and others. And also the main language is written in, the phase of the PPI process that it talks about, the target audience, and the knowledge level needed related to innovation procurement. Each of these resources has been included within a summary sheet that you can find in the website. And there you can see, as the one you can see in the slide, which includes the basic information about the resource, like the title, the main language, as said before, the source, where it comes from, and also a brief summary and some keywords about the resource. You can also access directly to the source through its original source with the available link in this summary you can find in the web. So next slide, please, Antonio. Concerning the planning phase that Antonio has just explained, we have selected some resources for each of the phases. So what's related to the planning, we have selected the first of them, the catalog, of the best practices on PPI. This has been identified within the InnoBroker project, and this resource has information about all the process and phases, and it's also for all the levels of knowledge in the procurement instrument. I've also wanted to say that in these resources, in this website, you can find more resources and deepening the knowledge of the PPI instrument. Or not only the ones that I'm going to explain now, but you have more of them. We have selected only a few of them for each phase. So next slide, please, Antonio. The other resource we have selected for the planning phase is the EAFIP toolkit that contains several courses, and it's also for several levels of knowledge and phases. And it's a good starting point, we think, to start having information and knowledge about the innovation procurement and the phase it is and the process it has that Antonio is explaining and will explain the next slides. So as said before, these are the resources we have selected for the planning phase, and now Antonio will explain the following phases, and I will have some reference to other resources to each of these phases, so you can have the tips to start with in the innovation procurement.
Thank you, Diana. Next, I will share with you a specific example of how to define a PPI strategy within the framework of a healthcare service. We will not disclose the name of the project and its promoter, as it is an initiative that has not been published yet, but will reflect the approach that has been taken and take this as an example that we can use as reference from the perspective of procurement planning. And it's also interesting because it includes the perspective of thinking about PPI as a strategic opportunity for healthcare agents. Okay, how do you think a health service should approach the design of a PPI strategy to improve its care services with innovative solutions? Okay, in this case, we are talking about a regional public entity, and this public entity follow this cycle to define a PPI strategy with needs that are innovative and linked to what health professionals need, and also is linked to what health researchers are working on. So the first step was to analyze the strategic framework of this entity and identify areas that have a high interest from the point of view of improving the healthcare service. So after analyzing the strategic framework in order to identify those priority areas, they identify some of the most relevant trends within those areas from the point of view of healthcare innovation. Once we have a clear perspective of what's important for that service and which trends are going on from the point of view of research, they collected challenges among the healthcare professionals and also researchers. So they have both perspectives, the perspective of a professional that is close to the patient and also the perspective of professionals that are performing research and development tasks. So then they analyze and prioritize the proposed needs, step 4, by conducting an initial market survey. They decide which challenges were more attractive from the point of view of innovation and also impacting the healthcare service. And then they perform a preliminary market analysis in order to make sure that there are no available solutions and also that there is enough a starting point to think that you can promote an innovative solution because you already have, for example, biomarkers, or you already have papers showing the way to deploy a new solution within a specific field that you are interested in. So you have to make sure that there is a starting point and also to make sure that there isn't a market solution that address those needs. And finally, they group all the selected challenges into different categories and define the specific objectives to conduct a preliminary market consultation. So more or less, those are the steps that they implemented in this case. We think that is a good example of how to implement this perspective of thinking about PPI as a strategic opportunity for public entities. Of course, you can think about different ways of implementing a similar way of working, but in this case, it is interesting because it puts together the perspective of a strategic framework, trends within the research activity, the perspective of professionals that are working with patients, with collecting challenges from them, and also the perspective of, okay, before defining the market consultation, perform a proactive market analysis in order to go to the market with specific objectives and with an initial perspective of what is realistic to expect from this project. Well, as you can see, this project is about 5P medicine, and the areas of interest in this case are biomarkers for cancer, obesity, and mental disorders, simulators for training in specific areas, advanced genomic analysis, and also solutions linked to advanced therapies, mainly for cancer also. And the main aspects that we want to stress about this project from the point of view of a public entity are those that are specified in the slide. From first, it is a project that gives us an example on how to align a PPI project with the existing strategies within the healthcare service. It is a project where we put together a trend that is emerging as 5P medicine, and at the same time showing that the PPI initiatives can be a way to implement the public sector strategies and not isolated projects. So we take a reference, something that was strategic for the public entity, and then the result of carrying out an internal process with the healthcare professionals, where we put together the perspective of research and also the perspective of professionals that are working daily with patients. From the point of view of a private entity, of course, it is an opportunity within the healthcare field, that's obvious, but it is interesting that the public entity identified a set of needs and challenges, but at the same time, within the scope of the areas that are pointed out as priority areas, they allow private entities to propose specific challenges. So maybe the view of that public entity is very restricted, and maybe a private entity can come with an idea that maybe is linked to the research activity of a group of research that are in another country of Europe or whatever, and they can bring ideas and add their challenges to the process. So that's an interesting part. That is an open consultation, also from the point of view of challenges. And another point that is also interesting for private entities is that the open market consultation includes a process for companies to express their willingness to collaborate with other private entities. So it's also an opportunity to share capabilities and to put together different capabilities in order to improve the proposals that they share with the public entity. And also an interesting part is that normally in open market consultations, the part of regulating intellectual property rights is included, but in this case, they include a specific aspect that is not normally iterated in open market consultation, that is the specific terms that market agents think that are reasonable for licensing new IPRs. So the price and the conditions that they think that are attractive for third parties in order to access those intellectual property rights, because for some stakeholders is an important part of the regulatory document and can be restrictive from the point of view of the willingness to join to the project. If you don't define the conditions that are applied to that access from the point of view of third parties, some big companies, for example, are not going to join to this project. So that's a key element that we also have to consider when promoting PPI projects, to look to the detail those terms regarding intellectual property rights and make sure that the conditions that you define are fair for all the parts. And once the regulatory document has been prepared, it will be time to proceed with its publication and the supplier selection and project execution. That is the phase that we are going to explain nextly. In this phase, we differentiate 4 main tasks. First, the publication of the regulatory document and the reception of proposals. Then the selection of different suppliers or one supplier, depending on the procedure. And then we sign the contract and we perform the execution of the contract with different phases and partial evaluations and a set of key performance indicators that are going to be the basis of the monitoring of the contract. Now we'll go deeper into each of those tasks. From the point of view of the publication of the regulatory documents, it is important to keep in mind that the regulatory documents should be published in a transparent and fair way, of course, according to the Public Contract Directive, and should include clear details about the evaluation criteria. Not only the evaluation criteria from the point of view of how you select your initial suppliers, but also the evaluation criteria that you are going to apply at each phase of the execution. As we are going to see later, normally, especially in pre-commercial procurement, you have different phases with different solutions running in parallel, and it's important to define beforehand specific criteria, so all the suppliers know what to expect at each step of the process and how the transition between each phases are decided. And it is important also to regulate all the detail about how to share the outcome of the project. That's an essential part on PPI projects. And also to consider the complete life cycle of the solution when evaluating the cost, for example. You have to consider that solution maybe is going to bring cost-saving benefits in the future. So it is a good practice to go from a traditional evaluation of price that is limited to the price that you have linked to the initial investment, but go to a complete life cycle perspective from the point of view of the benefits that have that solution to the in this case the healthcare service. And in this case, you can also include in the regulatory documents, for example, specific targets in terms of price. For example, you can set, okay, we are looking for a solution with a price of around 100 euro per test. And that's not a restrictive specification, but it's more a designing target. So you have to design your solution. So in the future, when you have a market commercialization of that solution, your design is meet that expectations once it is put into the market. Then you have the selection of suppliers. The award criteria can include different factors, such as the degree of innovation, the price along the life cycle, the functional performance, of course, and those criteria are set not only to select the initial suppliers, but also are linked to the transition between different phases, from the design of the solution to the functional testing of the prototype. Then once we select the suppliers within the contracts, and those contracts have to establish clearly the distribution of outcomes, the conditions that applies to third parties from the perspective of accessing to those IPRs, and also the contributions of each part, because public entities and private companies that are part of a PPI project can put into the project intellectual property rights that they have beforehand. And of course, it has to be clear what each part is putting into the project and how to distribute the outcomes. Then within the scope of the contract execution and partial evaluations, it is important to establish a joint working group with the suppliers in order to monitor the evolution of the contract with regular meetings, of course, and key performance indicators that are part of the monitoring of the contract execution. So depending on the funding source of the project, you may have additional aspects linked to budget execution, maybe how to communicate the results of the project, some impact indicators that you have to integrate within the scope of the monitoring phase. And it is also a good practice to divide the project into different phases with evaluation processes. You can take as reference maybe the design phase, the prototype phase, and the evaluation of the prototype, but you can think about the different ways to differentiate the phases within the scope of the project, and between each phase establish an evaluation process. It is important to write down clearly how the evaluation process is going to be in the regulatory document. It's a perspective that you can also include within preliminary market consultation. So sometimes it is not the case, but I would say that it's a good practice to include also the perspective of how to evaluate the results of the project at each stage within the scope of the consultation, because sometimes you have troubles within the execution of the project if you didn't perform that kind of iteration with the market, because of course if you want to define how to evaluate the partial results of an innovative project, the stakeholders that are going to perform those innovative developments can have a better understanding on how to realistically evaluate partial results. And now, once again, my colleague Diana is going to show you some relevant online resources linked to the execution of PPI projects.
Thank you, Antonio. So as you were saying, for this management phase, we have selected other two resources. The first one is the guidance on innovation procurement from 2021 from the European Commission, which is translated to all languages. It has all the information about the innovation procurement process, and it's for all levels of knowledge. So it's a good starting point related to the management of a PPI phase to know all that's needed in the process. And it's also important to highlight it's for all type of audience. Next slide, please, Antonio. Yeah, here. So the other resource we have selected for the management phase is the guidance on economic most advantaged procurement of innovative solutions from the EURIFI project. This resource is available in this case in English, has information about all the processes, but in this case is for more medium or high level of knowledge of innovation procurement. It's also for all type of audience, such as decision makers, suppliers, and any kind of audience that wants to have any knowledge about the innovation procurement. Thank you, Antonio.
Thank you. So, like we did with the planning phase for the case of the execution of the contract, we took as reference another healthcare project from a regional entity. In this case, linked to ultra-fast universal diagnosis of infectious diseases. And in this case, we are going to show with a practical example how to manage the development of PPI projects with different providers working at the same time. Well, in this case, in this project, it was decided to define in the regulatory document a series of phases during the contract execution, and each of those phases had associated an evaluation process that decided which suppliers would proceed to the next phase. In this case, we have 5 phases or steps. The first one, during the selection of suppliers, they selected up to 3 suppliers based on different criteria, mainly the degree of information, the value for money, and so on. But most part of the award criteria points were linked to the degree of information. And then once they selected the initial providers, they had a first phase where private entities iterated with the public entity to improve the initial design of the system with each supplier. This phase is interesting and is important because, of course, at first, each provider had a limited amount of information from the detail of the challenge, from the point of view of the specific needs of the public entity. And within this phase, they had the opportunity to iterate with the healthcare professionals of reference and redesign the system and they oriented the system to specific challenges and also to the specific set of previous systems that this client had. So that's a key part of ensuring that the execution of the project is successful, and also to ensure that the design that you validate as public entity meet the expectation of the final users that are going to be probably healthcare professionals. After that phase, they evaluate each design to select those that meet minimum requirements. At this step, they didn't have to select a limited number of providers. They could select all the initial providers. So it was an evaluation based on objective criteria. So it's a go or no go decision based on the intrinsic characteristic of each design. The idea at this step was not to limit the number of providers that are going to pass to the next phase. That is the development of the prototype with different prototypes in parallel. And each prototype can have the value of this phase is to allow different technologies or maybe different ways of approaching, in this case, the fast diagnosis of infectious diseases, in order to test different perspectives from the point of view, for example, of speed and cost, or maybe different perspectives from the point of view of the degree of information that we can get from the diagnosis, because maybe some technologies can give information, for example, about resistance or virulence of those virus, while another technology can be faster, but maybe give a lower degree of information. So it is interesting to test a different approach and decide once you measure at the fifth step, once you test and evaluate the final prototypes, you can check the performance, and you can decide the benefits that each way of solving that challenge can give to the healthcare service. So more or less that's the complete life cycle of this project, going from the initial selection of providers to the final functional evaluation of the prototypes. And this is an ongoing project that is ending, should end this year, focus on ultra-fast diagnosis of infectious diseases that we told before. And in this case, the key aspects from the point of view of the public entity are those that are mentioned in the slide. First, we think that conducting an initial phase of redesign can be an opportunity to align the initial proposals with the needs of the public service, a specific public service, and that's a high value phase. Also, the fact that they had minimum requirements associated with the functional design of each solution. So it's something that prevents you from wasting money in developments that are not meeting the expectations. So you having different phases, you can cut the project at different parts if one solution fails from the point of view of meeting the expectations. And also developing more than one prototype in parallel can allow you to test different approaches and different points of view between the different functionalities. For example, in this case, speed and cost. From the point of view of a private entity, of course, the redesign phase is an opportunity to know better the needs of this client and to improve your initial design. The evaluation reports are a good opportunity to have information about your competitors from the point of view of, okay, my competitor has this technology, I have this other technology, how both technologies performing in solving this challenge is an interesting perspective, because I can think that normally it's going to be hard in fields that are highly innovative. It's hard to have this view in parallel, and it's interesting also from the point of view of the private entity. And of course, successfully deploying the best prototype can be an opportunity for future acquisitions in an emerging market. So it's a kind of race, and if you successfully arrive to the ending point, you can be in a good position in an emerging market and take the solution to the commercial phase and successfully sell this product to other clients. Finally, we have the evaluation of results. This phase involves measuring and analyzing the outcomes that we get from the project and assessing contract compliance, evaluating if we achieve the innovation objectives, and identifying key learnings that enable the implementation of a philosophy of continuous improvement. That is, of course, is the idea every time that we implement a strategy or we start a new procedure. We want to make sure that we learn of each iteration and we implement those things that we learn in future PPI projects. Going deeper into each task, from the point of view of measuring analyzing the results, An evaluation should be carried out to know if we met the objectives that we established at the beginning of the project. This can imply collecting data, analyzing data, comparing results with the objectives and setups in the planning phase, and maybe perform surveys to end customers if we are talking about healthcare professionals, for example. The evaluation of the contract compliance is another dimension of the evaluation of the results. Within the scope of the contract and the project success, we have the perspective of contract compliance and the perspective of the fulfillment of project objectives. And especially in pre-commercial contracts, the risks associated with research and development activities, of course, are higher than those associated with projects that only have innovative activities without research and development. But we always have a degree of risk within the scope of PPI. So it should be possible to fail from the point of view of meeting the innovation objectives, but keep the compliance of the contract. And you can only meet this requirement if you define correctly the regulatory document. If you approach the regulatory document on a traditional way, you can have problems if your execution is not successful from the point of view of the functional objectives, and provide the supplier put all the effort to comply with the contract. So that can be a problem. You should establish functional objectives as something that guides the project, but not as something that the supplier has to meet in order to have a complete contract compliance. And finally, of course, the last part of this phase is to learn from the experience, is to identify what problems we had during the execution of this project, and also the lessons that we learn and what things we can change in the future to improve maybe the evaluation phase, or to improve the monitoring during the execution, because we had several problems, and we can put some preventive measures to avoid those problems in the future. Everything related to the willingness of improving continuously in the execution of PPI projects, or any kind of project in general. And now my colleague Diana is going to show some relevant online resources, in this case linked to the evaluation of results.
Thank you again, Antonio. So for this last phase, the evaluation, we have selected 2 more resources. The first one is a webinar on the evaluation and testing with tools and methodologies from the EAFIP initiative from the European Commission. It's a 15-hour webinar for European public buyers, suppliers, and policymakers. So next slide, please, Antonio. And the last but not least, the resource we have selected for this final phase is again from the RIFI project, and gives some information about the knowledge about applying a value-based approach to innovation procurement in healthcare, which is a topic that is very trend right now. And as said before, all the information concerning these resources, a total of 30 resources right now, but there will be more, have been listed in the project website, and we will keep on updating the information and adding new ones. So we invite you to visit the website and join our community to have access to this and other trainings that will be done in the following months. So thank you very much from my side, and thank you, Antonio.
You're mute, Antonio. Sorry.
Thank you, Diana. Sorry. I was saying that it is very important to take advantage of all the information that you have available in the website. So don't hesitate to visit the website and take a look to all the information. You have a lot of contents there, and please take advantage of all that information within the scope of PPI projects. And then we conclude the session with, before going to questions, we highlight the key aspects of a real project from the point of view of evaluating the results. Hopefully, this will provide you a practical guide on this regard and an example on how to implement these concepts that we are talking in abstract perspective. To do so, we'll refer to a third project, again within the healthcare field, this time related to the integration of genetic and clinical data. That is a hot topic right now, and where the complete potential of genetic information take place is when you link that information with the patient medical records. And in this case, how to evaluate these results from the point of view of a PPI project. Well, in this case, we have an example with 5 phases. As we mentioned before, within the evaluation of results, there we have the perspective of evaluate how the supplier complies with the contract, and we have the dimension of evaluating the results, the product, the solution itself. In this case, the phase 1 is related to the structure and process evaluation. And within this phase, we have elements linked to how the supplier meet the expectations from the point of view of contract compliance. Then we have a direct impact evaluation. In this case, it is related to the effect that the solution can bring to the healthcare system. Takes more the perspective of the public entity, not necessarily the compliance from the point of view of the private entity. A third step that is important is linked to surveys to healthcare professionals. They are going to be the end users of these solutions, and it is important to integrate their perspective within the scope of the evaluation of results. Not only key performance indicators that are, let's say, performance linked to the how it works, the system, but also the perspective of professionals that are going to use that system in order to, for example, integrate information that comes from genetic and clinical data. As a step 4, we have the global evaluation of impact and potential benefits once we have all that information, and the final evaluation reports that puts everything together and it links the final results in terms of deciding if the supplier complies with the contract terms, and we have to pay the contract without penalties, and also the part of considering the performance of the solution and to which degree the solution can improve the public service in terms of avoiding wrong diagnosis or shortening the period of time between the patient arrival and the correct treatment, and in terms of avoiding extra tests or avoiding shortening the period of time the patient is hospitalized or whatever. So the final evaluation hopefully will integrate those perspectives from the point of view of the healthcare system. That is going to be an important part in deciding if we deploy this solution, for example, in terms of cost and benefits. That is always the case in public services, to look for shortening costs that are each time are more important, and also improving the public service at the same time. That is a challenging issue. Well, as you can see, this is an ongoing project that puts together the clinical data and genetic information in order to well, have a complete perspective of the patient. From the point of view of the public entity, we want to stress how the evaluation cover different aspects related to the execution of the contract and also the performance of the solution, how the evaluation of the system should have a functional approach. So we evaluate the capacity of the system to address specific key performance indicators linked to the healthcare service. And it is very important to engage the healthcare staff, the healthcare professionals, within the evaluation of the solution with surveys for different profiles. You are going to have different professionals, and you have to think about the perspective of each of them before considering the degree of success in this project. It's not only a matter of performance, it is also a matter of how that system is going to engage with professionals, and how and if the system is easy to use, if it's adapted to the needs of those professionals or not. And it is also a good practice for the contractors to know from the beginning the criteria that you are going to use to evaluate the results of the project. So make sure that the regulatory document has all that information, that has a high degree of specification regarding the evaluation process at each step, not only at the closing of the project, but also after each phase. It can be the design, it can be an initial prototype or a partial development. At any phase that you are willing to implement an evaluation process, it is important to specify the way that you are planning to implement that evaluation. And from the point of view of a private entity that are involved in this, that is involved in this project, it is important to stress the internal quality assurance mechanisms that should be aligned with the evaluation set by the public entity. We are talking about the quality assurance that every project should have, and of course you have to align that perspective with the evaluation that you are going to have from the point of view of the public entity. So make sure that your developments are meeting the expectations of the public entity with internal quality assurance mechanism. If healthcare personnel is involved in the evaluation, it is a good practice to engage proactively with them during the proposal elaboration and also during the deployment of the system. You have to integrate the perspective of healthcare professionals at all the stages in order to make sure that you align the design and the development of the system with the expectations of different final users. And of course, include internal dimensions of the project evaluation, because private entities are going to have their own objectives from the point of view of business case and certification process and put into the market that solution. So you have to include your own evaluation process, because the result can meet the expectation of the public entity, but maybe that solution is not meeting your requirements, your internal requirements from the point of view of making sure that you have a good business case. So it's obvious that it's important to integrate that dimension, and from the design to the implementation, make sure that you put together the internal expectations and the internal objectives with the objectives of the client, in this case, a healthcare entity. And with this, we conclude our session, and now we'll proceed with the question and answer part, and I will say that thank you very much for your attention, and it was a pleasure to be here today. And yeah, please don't hesitate to question any aspect or ask for further details if you want to know any detail about those examples or whatever.
Yes, thank you. Thank you very much, Antonio and Diana. I don't know if there is any questions from any of the attendants. There's no questions on the chat. So in any case, if you finally have any doubt or would like to get more information from any of the topics that they were presented in this second part, please get in contact through the email contact of the Help Innofacilitator email contact, okay? And we will answer you offline, okay? Well, Diana, I would like to give you the floor just in case you'd like to add any more.
Yes, just a quick comment. Like I take advantage of the time we have, the spare time. So I am going to share quickly a slide to ask you for your help to have a final feedback from your side about the workshop. So give me a second. We will send this information also by email, but just in case you want to do it right now, we have created a final survey to have your feedback and just asking you for your help and contribution with this. You can access through the QR code or the link, and that's all from our side. It's a quick survey. It won't take more than 1 minute to you, and it's through the SurveyMonkey platform. So from my side, anything more? We will send, as I said, the information by email also, in case you want to do it another moment, but we ask you to do it as soon as possible so you don't forget about it, as it's very useful for us.
Thank you. Thank you very much, Diana. Let's keep this slide in the screen for a couple of minutes. And thank you to all of you for being part of this workshop. Bye-bye. Thank you.
Have a nice day.
Thank you. Thank you. Bye.
Bye.
Bye. Thank you.
In the scope of the